when I did a data and analyzing the trust factor, I found the trust in some of the hospitals or doctors in India is below 50%. Let us say certain schemes, insurance company, government schemes, doesn't pay for immunotherapy, certain drugs. You have a 28-year-old patient who, based on the genomics, based on the markers, requires certain drug, for example, Herceptin for breast cancer, or immunotherapy, hot tumor. The system denies. I've had this happen multiple times, and we compromise. We know that is the right thing to do, but we compromise and give the treatment, and the patient recurs in 1 or 2 years. Who is responsible morally? Who is responsible? Am I responsible knowing I have a knowledge, but I am not doing the right thing? Is the patient family responsible? They have trust. They think we are doing the right thing? Or is the system responsible, which are not reimbursing for it, which is not paying? The patient comes first. It is very patient-centric. I have to get up in the morning and do the right thing for that patient. Hello everyone. Today I am going to be talking about doctors, the profession of doctors, how patients, community look upon doctors, and what is the relationship between the two, and how it has evolved over the last several decades. I have been a doctor for the last 50 years, and I had the privilege of practicing in the United States for nearly 25 years. Then I came to India, moved to India, and started the HCG group of hospitals and also the Bharat Cancer Hospital in Mysore. In this experience, I learned a lot, not only about cancer, but also about human relationships and approach we public takes towards doctor. What was it in the past, how it has changed, and why it has changed. Before we go into the details of this, I want to first of all tell you a little bit about what doctors go through. And I'll share it with a little bit of my own experience. First, you do your MBBS. After your 12 years of high school, PUC, then you do MBBS, nearly 5.5 years. Then you try to do your postgraduate training. And then after that, sometimes we end up doing super specialty training in a specialty we like. For example, you take oncology, you have to do additional 3 years to do your DM in oncology, MCH in surgery. When you do this kind of specialties, even in cardiology, you have to do the same. Almost 10 years you spend in going through this training, professional training. Believe me, it is not easy. You take calls, night calls, and you really go into the depth of what is patient care. You try to understand what is the disease. You try to find the right solution. Sometimes, as I say, the buck stops at you. If something doesn't go right, you spend sleepless nights, you get calls. In my own case, when I was practicing actively in US, when I started my practice, within 1 year I started seeing 100 patients a day. And at that time I was single. Then after I got married, my wife Bhagya's comment was, "You never see the daylight. Why have you bought this house?" Because I used to leave early, particularly there in winter time, it gets dark very early and it gets light very late in the day. So I used to leave in dark and come home in dark. So these are all the trials and tribulation one goes through. Then when you fast forward today compared to late 70s and 80s, what is the difference? Of course, communication has increased, technology increased. So let us take a step back and see what was in 1970s, 80s, when there was no email, there were no cell phones. You had to contact through regular phone. Even there, it was not that easy. There was somewhat of a trust. It was mutual trust. The patients believed the doctors are doing the right thing. They accepted it. And if some things don't go right, they also knew everybody has tried very hard. It didn't happen. There was also issues with some doctors who maybe they did not have the knowledge. Something which was done, consequences were there. And as you know, in US, there are a lot of legalities and all people would go through. But overall, I should say, in my 25 years, I saw that trust as an important factor, and that was binding. When I started looking, even in India at that time, before I went to US, I did practice for a year. I saw that how doctors were respected, community, society, that was there. And that is the reason possibly our parents wanted us to be doctors, because there was some social recognition. Oh, my son is a doctor, he is specialized in this. And people would take pride in it. Now, when we come to 2000 onwards, technology, smartphones, and knowledge dissemination, you have Google, you have ChatGPT now, things have changed. Some of it for the good, some of it concerns me. For example, when I did a data on analyzing the trust factor, I found the trust in some of the hospitals or doctors in India is below 50%. What does that tell us? General public, when we took a focused approach and say, how do you trust the doctors? It was about between 40 and 50%. Why is it not 90 or 100%? And part of the reason is, as I said, advancement in medical field being complicated, and educated people who also want to do their own research and start questioning, why is this needed? For me, practicing oncology even now, seeing advanced and recurrent tumors, asking questions is very important. Knowledge of the patient and family, very important. I will just give you two examples. Recently, I had a patient who was 101-year-old with a oral cancer, and their family members all come. She comes from a village near Devanahalli, and I was talking to them. They all came. They didn't look that sophisticated, very nice people. And then I was talking to them about why at that age I may not give certain drugs, why surgery is not possible. And then suddenly the grandson said, "Doctor, what about immunotherapy? Is she PD-L1 positive?" He asked me very good questions. I was surprised, and he had read everything. And another granddaughter spoke in very good English language and said, we have all come here to do the right thing for my grandmother, and let us do the right thing. I loved it, because this kind of discussion is very healthy. And as I explained to them everything, I think it built the trust. It built why we are doing. So part of the reason here, this example I am giving, is how much time a doctor spends with the patient is very important. How do we understand what are the possible concerns they have? Mainly, in my view, there are two concerns. One is about the disease, about what are the possible treatment, what are the side effects, how does the disease come, and is this treatment going to work, quality issues, all of that will come into play. Of course, it all depends on the age of the patient and the dynamics of patient's approach, attitude. The second is about finances. They will be apprehensive, particularly in the middle class. There is always a question, what is the cost? Can we bear? We want to do the right thing, but how do we come up with the cost? And one of the things we don't know is lot of people in lower socioeconomic group go through a lot because of this financial entrapment. And that also has to be addressed. While we are doing it, my question always has been, what is the role of a doctor? What is the role of a doctor who is trained, super trained? Is he supposed to do the right thing for the patient? Or do we try to compromise because of the cost? Something we all should think about. We should pause for a moment, take a step back and think. Doctors, patients, everyone. Because in my view, why have you come to the doctor? Why has a patient family come to the doctor? To advise the right thing. Not cut corners and make it so-called affordable, but not do the right thing. Particularly in a field like cancer, first time when you don't do the right treatment, what are the consequences? The cancer will recur, chances are high it recurs, you go through a lot of suffering, lot of financial implication, lot more than treating the patient first time right way. And this is something, a detailed explanation should be done to the patients and family, and given the story behind the story, why were we doing it? For example, let us say, other day I had a patient, another patient, I wanted to do a particular test. The patient asked, why are you doing this test? I explained to them, an MRI will show us certain thickening of the peritoneum. There is an area where I can see whether the disease is going to respond or not in the future. Oh, you did a PET scan. Why do you have to do it? PET scan is different from MRI. PET scan is like a CT scan which shows metabolic activity. So I spent a lot of time explaining. I could sense the patient relative was asking all these questions because they were worried about the cost. And they were also possibly thinking, is this institution, doctor, ordering more tests because of monetary reason? Maybe. See, that is where the trust comes. And that is where we have to build trust. And that is a long road. You have to take one issue at a time, address it, give explanation. Your staff, your nurse, your medical social worker should help. And also understand the family's financial dynamic situation and see how we can also help. For example, sometimes when I have to do, for example, let us say it is a oral cancer. Sometimes I have to do MRI weekly to assess whether the treatment is working or not. So what I do is, I will say without any cost, let me do it after the first MRI, for the next 3 MRIs. So I will understand treating doctor whether it's working or not. So why should the patient be charged for it? So these are some of the models we have to create so that there is a binding understanding and trust. Now the other issue when it comes to healthcare, because of today's Google, ChatGPT, so much information, is the question of getting second opinions, third opinions, fourth opinion, fifth opinion. I want to say this, I have had number of this. People come to us for opinion, people from HCG go for opinion, go to doctors. There is a lot of confusion. One thing for sure, a second opinion cannot be given effectively unless you see the patient and the family face to face. Very difficult to give the right opinion. Look, take for example a cancer scenario. What is it we have to assess when the patient with cancer diagnosis comes to us, our multidisciplinary clinic? We have to look at the patient, age, performance status. Look at the psychological makeup of the patient. Either positive, negative, what is their approach, family's body language. Then we have to look at the diagnosis, what kind of a tumor it is, Where is it originating from? Is this an aggressive tumor? Is it a low grade, high grade? And is it a hot tumor, cold tumor? What is the immunogenicity of this tumor? Is it PD-L1 positive? And what is the genomics of the tumor? When I say genomics, is the question of why. Why did this cancer? Other day I saw a lady who is 27 years old with certain cancer, breast cancer. Why should it come in a 27-year-old? What are the reason? And is this a reason which we can understand, and so we can give appropriate treatment to overcome it for a long time? And what are the genomic mutations? What do you mean by genomic mutation? When you have gene sequencing, we do 500 gene sequencing, now we are about to do complete gene sequencing. It will tell you whether there is any alteration in it, so that gives a signal, and so that the cancer cells will continue to grow, they don't die. Because of the mutation, what is the main difference between cancer and normal cells? Normal cells will stop growing, they stop multiplying after a certain period of time. They have a programmed death. Whereas cancer cells keep on growing because they become rogue cells because of this mutation. So the signaling is such, hey, you don't have to die, you can keep on growing. And they are not functional. They are non-functional rogue cells. So our goal is to change the mutation so that the cancer cells also die with therapy. So it has to be a deep dive, and as I always say nowadays, it has to be very patient-centric. And going back to my previous treatment, first time right treatment is the key. So there is nothing like usually emergency in cancer care. We have to do right thing. If some doctor says, oh, I have to start the treatment tomorrow only, I have to do this surgery tomorrow, I don't accept it. I think we have to take time, analyze and do the right thing. When you analyze and take a step back, whether the patient fits in for, let us say, for surgery, are we doing the right surgery? Is it possible to do right surgery? I have a patient who came from different parts of the world, whose surgery was incomplete. What happened? Because of that, we had to do resurgery, went through lot of scarring, lot of issue, and even today she cannot eat properly because of that. So first time when you don't do right treatment, it causes significant problems. Suppose a surgery is done where what we call as margin was not clear, the patient is likely to recur. So if the surgery is done somewhere in untrained hands, what happens? When the patient comes to us, we have to say, how can you go and tell the patient that this is incomplete surgery, so you have to manage it also. But we as a team have to understand incomplete surgery, so can we do surgery again, or should we do therapy, targeted therapy, chemotherapy, radiation, then do surgery? All of these complexities has to be discussed as a team. The medical oncologist, radiation oncologist, surgical oncologist, pathologist, psychologist and genetic specialist, all of them are involved. So it's a complex process. So in my view, I think while getting a second opinion, third opinion may be okay, but it has to be looked upon very cautiously. And also, cancer is such a complicated disease. One single person giving an opinion doesn't make sense to me at all. I see a lot of complicated cases. People are told nothing can be done. When they come to our HCG, we put in such effort to see whether we can go into the depth, deep into this disease and come up with some solution so that we can create a remission. Even it could be a short-term remission. And sometimes the families know, patient knows, but they still want it for particular reason. Because I've had patients come and tell me, my daughter's wedding, son's wedding, graduation, grandson's graduation. So there are so many issues which even in advanced cases patients want to live so that they can experience these situations in a very pleasant way. Yesterday I saw a patient, the son was, she was doing very good with lung cancer, gone into remission, advanced disease. I told the patient, you're doing extremely well, it's because of your attitude. And the son with a great smile said, it's because my mother wants to live. She's putting all the efforts. She's in her late 70s. Amazing statement. See, this positive attitude, the trust in doctors goes a long way. And in my view, as we go forward with either cancer or, whether it could be brain diseases, dementia, Alzheimer's, cardiovascular disease, renal issues, dialysis, there are and respiratory failures. There are so many things going on, liver disease. We have to really look at this approach to this disease from the patient viewpoint. Yes, knowledge is very important. B, understanding that knowledge, relationship with that, with the test findings is very important. That needs a detailed explanation from the group of experts. So the patients usually should ask for a group decision, what we call as tumor board multidisciplinary clinic. The doctor can also do this. He can say, I've consulted these doctors, I've consulted, based on that I'm giving the opinion, which could be fine depending on the situation. Then the most important thing is detailed explanation should be demanded to the satisfaction of the patient and family. But at the end of the day, having suspicion or trust will not go a long way. Will not go a long way. For example, I will tell you one not good incident I had. A patient had come with a doctor friend and family. It was a tongue cancer. We treated the patient, all the team put together, immunotherapy, patient gone into remission. Then patient said, we wanted to look at the scan. The patient said, I got the scan outside. Do the people understand how difficult it is to read, interpretation, put together with our scan and make a diagnosis? Just for the sake of few hundreds of rupees or 1,000 rupees, she said they decided to get it outside. I said, look, in that case, it will be very difficult for us to treat because I want to do justice to the patient. I told them, if you cannot afford, talk to us. We have a foundation, we have a system to give you whatever we can to help so that the treatment can be completed. But they were not willing to listen. So I said, in that case, we can't do it. Because we are very clear, the patient comes first. It is very patient-centric. I have to get up in the morning and do the right thing for that patient, not compromise. Here is a situation when, let us say, certain schemes, insurance company, government schemes, doesn't pay for immunotherapy, certain drugs. You have a 28-year-old patient who, based on the genomics, based on the markers, requires certain drug, for example, Herceptin for breast cancer, or immunotherapy, hot tumor. The system denies. I've had this happen multiple times. And we compromise. We know that is the right thing to do, but we compromise and give the treatment, and the patient recurs in 1 or 2 years. Who is responsible morally? Who is responsible? Am I responsible knowing I have a knowledge, but I am not doing the right thing? Is the patient family responsible? They have trust. They think we are doing the right thing? Or is the system responsible, which are not reimbursing for it, which is not paying? It is definitely a quagmire. It's a difficult situation to understand. This is why we are all fighting for universal health care. So, whether rich or poor, they can be given the same treatment, no limitations. What is the right treatment we can do? Hopefully, India will advance to that level, like what we see in other countries. Not only in European or America, but even Brazil does that. Why can't we do it here? Is what we are pushing for. We want to change. I was before the parliamentary committee requesting that. We have written letters to the government, Niti Aayog, health department, but we have given solutions. Hopefully one day we will find a solution so that equality will become for all. Meanwhile, we have to understand what is the difficulty. We all have to help the patient and the families so that they get the right treatment. They also have to help to get the right treatment first time, so the disease can be managed the right way, so the recurrences will not happen, and eventually we can win the war on cancer. Thank you.